Hi, this is Nigel Kennedy from the Village Dental Centre in Brighton, home of pain-free dentistry. I'm here today to speak about dental implants, what they are, why you might need them, and what the benefits are. So what is a dental implant? Basically it's a little titanium screw that's about that length. It's used to replace your natural teeth. So when might we need them? It might be that you've got some gaps that you don't like, that are a bit unsightly, ugly, where you've lost teeth maybe recently or even many years ago, and you'd like those teeth to be replaced. The alternatives when you've got a gap, of course, is to do nothing, leave the space there, but that's not a great idea because A, it doesn't look very good, but more importantly, your other teeth tend to tilt into the gap, or teeth over-erupt, they drift into new positions, and often you can end up with gum problems. So the alternatives are to put a bridge there, which means fixing the teeth on either side to support this new tooth in the middle. But the trouble with that is it involves other teeth, and if something goes wrong, you've now got two or three teeth all strung together with the same problem. Dental implant just replaces the tooth that's missing. So that is the beauty of it, and they last the rest of your life. Success rate is very high at 98, 99%. Okay, so when might it help you? Also, patients who are about to lose a tooth, you can sometimes, quite often nowadays, put a dental implant in straight away. You're already numb, the tooth's been taken out, why not put the implant in there and then it goes straight into the hole that you've got? And then we just leave it to heal and we can put a cap or a crown back on top. We can use it in situations where you've got maybe a poor fitting denture, you're embarrassed by your denture, it doesn't stay in properly, you avoid certain things to eat, sticky foods, steak, etc. etc. You don't go out or you're unhappy speaking in public. Two dental implants underneath that denture connected to the denture might be enough for you to have a very retentive or denture that will stay in place and it won't embarrass you when you go out. Earlier this year I went on a course in the States in San Francisco to find out the new procedures in dental implants that would make it easier for me to provide them and also much better for our patients to have them done from the point of view of, a less onerous, invasive procedure than I felt it was. What I found out was really quite revolutionary, and I'm now using it in our practice on a daily basis, and patients have found that it's great. The nice thing about this procedure is it's so much simpler than before. If you're missing a tooth, all we need to do is make a tiny little hole in the gum, almost the same size as a matchstick head. Through that little hole in the gum, we can then just twist this little titanium screw in through the little hole in the gum, and it tightens into the bone. We can take a mould of it there and then, send that mould to the laboratory, and only 8 to 10 weeks later we can be fitting a crown on that tooth. There's no surgery involved, there's no pain afterwards because you've not had any cutting of the gum and stitching and all this type of stuff, and there's no second procedure to come back to months later when it's sort of formed with the bone like there is with conventional procedures. What they have to do is wait until it's all healed, find the implant again, and then connect it up, which means a second lot of surgery. With ours, there isn't a second phase. So it's much quicker for you. You've got your new tooth in only 8 to 10 weeks, as opposed to 3 to 6 months. There's only one bit of, we wouldn't even call it surgery, tiny little hole in the gum like keyhole surgery, as opposed to 2 visits of quite involved surgery. It's much easier for you as well, and it comes with our pain-free guarantee. In other words, if it's painful, then you get your money back. We avoid the painful side of dentistry by using warmed anaesthetic, which is at body temperature. We use anaesthetic paste, which is like a numbing gel we put on for a good 2 minutes before we even start to allow it to work. In fact, you can already feel your lip tingling with the anaesthetic paste. We then numb you up with nice warm anaesthetic rather than cold anaesthetic, and we use very short, fine needles, so it really is pretty painless, this whole procedure. If you're really worried about it and you didn't want to know anything about it, and I can understand that, some patients just don't want to know, then you could have sedation or sleep dentistry, we call it, where we have an anaesthetist, a friend of ours who's called Rex. We've known him for 20 or 30 years even, and he comes to the practice. He will take care of you, make sure that the whole procedure is nice, anxiety-free, stress-free. You can have your treatment done, and you can go home that day, and you will not remember it either because it's amnesic. So that really is a nice way to do it. All of this also comes with our delivering you to the practice in a taxi and taking you home in the taxi, so that you don't need to walk out of the practice a little bit disoriented from lying down, anaesthetic and so on and so forth. Finding where your car is, we'll have a taxi bring you to the practice and take you home afterwards, so you can't beat that. If you'd like to know any more about this process, what it involves, or any more about dental implants, just ring us on Brighton 885552 or contact us at the Village Dental Centre, www.villagedentalcentre.co. Cool.